Pwede na sir, pwede na kayo mag-share.
Pwede na ako mag-record? Okay.
Yes sir, opo.
Okay, good afternoon. Let's start.
Good afternoon, Professor.
Okay,
Good afternoon po.
good afternoon. Okay. Okay. Okay, I can hear you now. Okay, you can hear me. Okay, so let's start. I was asked to give a lecture with this title, Importance of Hospital Quality Accreditation for HA202, with the following prescribed learning outcomes or objectives. Number one, understand the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services. Number two, discuss the philosophy, objectives, structure, staffing, policies, systems, and methods of hospital quality accreditation. Number three, develop the ability to pinpoint and isolate management and administrative problems in the hospital quality control program and offer solutions, relevant solutions. And number four, draft a hospital quality management system framework pattern after the ISO 9001-2015 version framework that can be used as a guide for developing a hospital-wide governance and operations manual. Let's start with the first learning outcome or objective. A patient client tends to go to a particular hospital because of known quality services in this hospital. A physician client tends to send his or her patients to a particular hospital because of known quality services in this hospital. A hospital wants to attract patient clients as well as physician clients to its hospital through its quality services. These three primordial realities and practices constitute the first general driving force or forces why a hospital and its departments and services should promote and offer quality services to its clients. Promoting and offering quality services to patient clients and physician clients should be part of the business development program of the hospital and its departments and services in attaining financial viability and sustainability. The hospital and all its departments and services should have a quality management system in place as part of its business development program. So the hospital should have one, aligned and integrated with the quality management system of the departments and its services, all for the purpose, the overall goal is a business development program. The quality management system includes defining first the quality expectations of the patient clients and physician clients, and then finding ways on how to meet these expectations. After the quality management system has been developed, it should be institutionalized by continually doing quality control, meaning continually fulfilling the requirements of the clients, and documenting it on a manual that contains the quality control standards which all the staff, all the members of the hospital should know, adhere to, and make decisions according to what is written in the manual, what are written in the manual. So aside from making patient clients and physician clients experience and appreciate the quality services, the hospital can go for external accreditation. External accreditation, not only to have affirmation and validation of its quality management system, but to utilize the external accreditation for marketing. As mentioned, it can be used for, it should be used for business development program. Thus, the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services are to attract the patient clients and physician clients to utilize the services of the hospital because of the reputation of quality services that result from adherence to quality control standards. Let's now go to the second learning objective, which is to discuss the philosophy, objectives, structure, staffing, policies, systems, and methods of hospital quality accreditation. Here I will present the theories and ideas, information on hospital quality accreditation as being practiced in the Philippines. I hope there will be some similarities in Malaysia. And my personal thoughts, perceptions, opinions, and recommendations on hospital quality accreditations. First of all, what is the difference between hospital licensure and hospital accreditation? Hospital licensure means obtaining an official and legal permit to operate a hospital from the Department of Health or from the Ministry of Health. The permit is granted after the hospital fulfills certain minimum requirements imposed by the Department of Health or Ministry of Health in Malaysia. And these requirements include those that ensure, number one, structural and operational safety, human resources requirements, and among other things. Furthermore, they may include an imposition in black and white, the presence of a quality management system. Hospital accreditation is operationally defined as the processes by which a hospital voluntarily applies for recognition or attestation of compliance to a certain set of standards by a third party. The standards can be anything that the hospital wants to have an external recognition of compliance and wants to use it for business development purpose. The standards may be hospital management system, quality management system, environmental management system, disaster response, recovery and business continuity program or standards, etc. There are a lot of other systems that we want to be accredited with. Thus, the main difference between hospital licensure and hospital accreditation is the required legal permit to operate. This is for the licensure. And for accreditation, the voluntary seeking of recognition for recognition or attestation of compliance to certain standards, again, to be used for business development. What is the difference between hospital accreditation and hospital quality accreditation? There may be a difference, or they may loosely mean the same thing. In the strictest sense, they are different. Hospital accreditation is the process by which a hospital voluntarily applies for recognition or attestation of compliance to a certain set of standards by a third party. There's no standard that is specified in the phrase hospital accreditation. Whereas in hospital quality accreditation, the standards sought for accreditation is the quality management system standards. So it's specified, and which is the quality management system. That's why it's called hospital quality accreditation. As I mentioned earlier, hospital accreditation and hospital quality accreditation may loosely mean the same thing. Although there are various sets or subsets of standards to be assessed and accredited with, such as the generic quality management system, quality healthcare and patient safety management system, human resource management system, environment management system, and emergency and disaster management system. All these subsets may loosely be called quality management system or different types or subsets of quality management systems. So if this be the case, then the hospital accreditation and hospital quality accreditation may be the same. So it may mean the same thing. One just have to qualify the definition of terms to be used. To further amplify on the use of the two terms, let me introduce ISO and its working on certification of standards. ISO is the acronym for International Organization for Standardization. It is headquartered in Switzerland. It is most popular and respected worldwide organization that works on standardization of things, anything, practically anything. It defines the rules and standards to aid in the task for virtually all products and services. That's why I said anything. All products and services that people use, including rules and standards about how products and services are made and to be done, and how quality control tests should be performed. ISO has about 300 standards that organizations can seek certification from. Some examples of ISO standards which are identified by numbers and also the version. Example, ISO 9001 is the quality management system. Then if there is a number after that, 2015, that's the 2015 version or the edition. Then you have the ISO 14,000, you have the environmental management, then you have the ISO 31,000 risk management, then ISO 26,000 2010 version social responsibility. In the Philippines, the most popular standards being sought for by organizations, particularly the non-medical enterprises, meaning in the, let's say, not hospitals, not clinics, okay, is the ISO 9001, which is on quality management. The second one is usually ISO 14,000, which is environment management, because usually the industries want to be known for its good environmental management. An organization which has an ISO certification should specify the type. For example, an organization X has an ISO 9000 certification. This just means it has certification on quality management system. And organization Y has ISO 14,000. So it just means that it has certification on environmental management. It is incomplete when one says an organization is ISO certified. You have to specify it. One has to complete the description by specifying the type of certification. So the same thing is also true with hospital accreditation. One should not just say the hospital is accredited. Accredited with what? One has to specify which standards or which organization which represents the set of standards. In the Philippines, the following accreditation and certifications has been sought by hospitals. Let's now talk about hospitals. ISO 9001, quality management. ISO 14,000, environmental management. Quality healthcare and patient safety management. Usually, the more popular organizations doing accreditation for this category is the Joint Commission International, or JCI, Accreditation Canada International, or ACI, PhilHealth Benchbook, and then the Philippine Quality Awards, which try to examine the system, the total quality management system of an enterprise, and then the investors in people, human resource management. So with the various accreditations and certifications being sought for by the hospitals, when one talks of achieving an accreditation or certification, one should specify the name as well as the number, especially in ISO, because there's a version there, version, edition. Going back to our topic, what is hospital quality accreditation? I repeat, it is the hospital's voluntary application for recognition or attestation of compliance to certain quality management system standards set up by an external organization to be used as part of the business development program of the hospital. And for the purpose of my lecture, I will be referring to the standards ISO 9001, Philippine Quality Awards, Quality Healthcare and Patient Management Standards being recognized by being surveyed by the Joint Commission International, Accreditation Canada, and Field Health Benchmark. Now let's backtrack a little bit. What is quality management system? ISO defines it as a management system that pertains to quality. There are a lot of definitions when you read the internet, the literature. There are a lot of different definitions of quality, okay, or quality management system. Let's just use the ISO. So ISO defines it as a management system that pertains to quality. But what is quality? Quality is defined as the degree to which an object or an entity, example, a process, a product, or a service. Okay. So the degree to which this type of object or entity satisfies is a specified set of attributes or requirements, the requirements of the standards. This diagram shows the current framework of the ISO 9001-2015 quality management system, with customer requirements as one of the main inputs here, and customer satisfaction as one of the main outputs. The throughput uses the plan, do, check, act cycle in the integrated elements of leadership, planning, support and operations, performance evaluations, and improvement. So formulated standards are seen in number 4, which is the quality management system. So if you have a manual, there should be standards that should be contained in this chapter, this number 4. Then number 5, leadership. Number 6, planning. Number 7 and 8, okay, support. 7 is support. Number 8 is operations. And then number 9, performance evaluation. And number 10, improvement. The Philippine Quality Awards is this total quality management system or framework, total quality management or performance excellence framework. Initially, the PQA has focused on business enterprises, not the medical enterprises. So that's why initially it has the so-called business criteria for performance excellence framework. Now it has expanded to hospital industry. There is now a PQA, Philippine Quality Award, healthcare criteria for performance excellence framework. So formulated standards to fulfill are seen in leadership, strategic planning, customer focus, measurement, analysis, knowledge management, number 4, workforce focus, operations focus, and then the results. So if you look at this, somehow you can see the similarities between the two, okay? ISO and then the PQA. So in the PQA, it puts a lot of emphasis on the results. They want to see the results. Okay? Of course, in ISO, they also want to read the results, but it's not emphasized in the framework. Examples of quality healthcare and patient safety management standards that are currently sought by the Philippine hospitals are the following: Field Health Benchmark, Joint Commission International, Accreditation Canada International. Okay? Comparing the 3 hospital accreditations, all are inherently for hospital accreditation and not for the business, for the industry, okay, manufacturing industry. Okay, so it's all inherently for the hospital accreditation, unlike ISO and PQA, which started and more inherent in business and manufacturing industries. All 3 emphasize these three, okay, quality healthcare and patient safety management standards, all of these three emphasize the importance of quality healthcare and patient safety. Before, it used to be just quality healthcare. Nowadays, it put emphasis on patient safety. That's why it includes always this phrase in the title of the standards. All three have two major categories of standards. Let's just look at this one at the center. Namely, patient-centered standards and healthcare management standards. This more on the administrative part. This one is on patient care. Accreditation fees. Hospital accreditation almost always entails fees, or you can say always entails fees. There's a fee for the survey or the assessment, and then there's also a fee for the certificate that will be issued to you. How much the fee are is dependent on the accrediting body. This table shows the various accreditation fees. Just take a look. They range from 10,000 pesos for PhilHealth bench book to 14 million for Joint Commission International, JCI. Okay, ACI about 8. So for Philippine Quality Awards, for small organization, you have to pay 30,000. And then for bigger organization, 50,000. For ISO, 300,000. So all of these fees can change anytime. This is as of 2022. Now, what are the currently sought accreditation by hospitals in the Philippines, advantages and recommendations? Number one, PhilHealth Bench Book. It's a local standards directly related to Philippine hospitals. I don't think we have this in Malaysia. So there's another term probably in Malaysia. It will be needed for licensure with the Department of Health. My personal recommendation, all the Philippine hospitals must have, for viability and sustainability reasons, be recognized by the PhilHealth Bench Book. Now for the joint JCI and ACI, these are international standards directly related to hospitals again, but recognized internationally, globally, and therefore prestigious. My personal recommendation is just go for one if a hospital has a medical tourism project and needs leverage with international collaborators and partners. Okay, just choose one if you have to. ISO 9001, this is also another international standards on basic quality management system that are applicable to all kinds of industry, including hospitals and healthcare. My personal recommendation, go for it if an international accreditation is deemed needed and necessary and the hospital cannot afford the high cost of ACI and JCI. Now for the Philippine Quality Awards, this is a local standards that cover all kinds of industry, and there is a specific set of standards in healthcare, as I mentioned earlier. My personal recommendation, go for it if the hospital wants to have the highest, most prestigious quality awards in the Philippines. It wants to be known as the best hospital in the Philippines because this is being awarded. This particular award is being awarded by the President of the Philippines. Okay, so it's really a national award. Now, the objectives of the hospital quality accreditation. The general and overarching objective will be the following. Hospital quality accreditations are used for business development program of hospitals to enhance the reputation so as to attract more patient clients and physician clients to utilize their services, thereby promoting financial viability and sustainability. Specific objectives are the following: to increase the hospital credibility and to demonstrate its accountability to the community using an attained hospital accreditation, to increase its leverage with potential partners and collaborators in the healthcare industry using the attained hospital accreditation, especially in areas where you may have medical tourism program or foreign patients. To use the accreditation project as an assessment tool on hospital performance as well as a change management agent or tool. To identify and institute areas of improvement towards excellence with the help of hospital accreditation projects. To educate the staff on performance excellence with the help of hospital accreditation projects. Now, as to the structure of the hospital quality accreditation, the hospital quality accreditation can be looked at as a program or as a project. It can be temporary or permanent. My recommendation is that it should be on a permanent basis once the hospital administration has decided to go for hospital quality accreditation. The first reason is that the accreditation is usually for a limited time period. It has to be renewed, say about usually every 3 years. Number 2 reason is that there is a need to continually train the staff on quality management system and to continually monitor the conformance to the standards. The hospital administration can either create a committee or an office for the hospital quality accreditation program or project. Committee if the program would be short-term, and an office if the program would be long-term. As to the staffing of the hospital quality accreditation, strictly speaking, the staffing of the hospital quality accreditation program involves all staff of the hospital, from top management to rank and file, and all working in an aligned and integrated fashions towards attainment of external recognition. So it should also include the top management. It's not ideal to say that the top management just delegate it to the lower hierarchy to do the quality management system. The top management should be involved here. To orchestrate the or direct the hospital quality accreditation program, as I said, a committee or an office may be created, and the staff in this committee or office will be those knowledgeable on hospital accreditation processes and who can teach the rest of the hospital staff on quality management system, particularly on how to fulfill the requirements of the required standards, and those who have leadership and managership skills. So this the staff should be able to teach because it's not easy to follow all the standards of the external accrediting bodies. So there must be some coaching or teaching by some people who are knowledgeable on this. Since the hospital quality accreditation is a hospital program and also hospital-wide, all the staff should be engaged, aligned, coordinating, collaborating, and integrating with each other to promote the success of the program. A steering committee should have a multi-sectoral membership. So that there will be a participatory management. Cross-sectional or multi-sectoral membership with representatives from the key functional areas in the hospital, such as the following. These are just examples. You can put in some more. From the medical service sector, nursing, ancillary, administrative, human resource, business development sectors, finance sector, and also an office with a secretariat or a committee, if such be the case. The policies of the hospital quality accreditation, the primordial policy is that once the hospital quality accreditation is set up, all the staff of the hospital, from top management to rank and file, should be working in an aligned and integrated fashion towards attainment of the external recognition and attestation of compliance by a third party. The other basic policy should be the following. So you should answer the questions: what are the authorized functions and authority of the Hospital Quality Accreditation Committee or Office? what are the punishment and rewards for non-conformities and excellent conformities, respectively, on established quality management standards. Now, as to the system of the hospital quality accreditation, so this invokes the system approach and system thinkings that we talked about last time. All the departments and services should be involved in hospital quality accreditation or project or program. All the departments and services should be aligned, coordinating, collaborating, and integrating with each other in the hospital quality accreditation project or program so as to ensure attainment of the external recognition of accreditation. And it goes without saying that all the quality management system of all the departments and services should be aligned and integrated with each other, among each other, to attain the highest quality, degree of quality. As to the methods of the hospital quality accreditation, so the first step is that top management decides to have a hospital quality accreditation project. And the purpose, the objectives will be to promote the business development program of the hospital so as to make it viable and sustainable, and to use it as a change agent to fast track the quality improvement. Of course, there are other reasons that can be put up here. And then after that, the top management creates a steering committee or team or an office for a hospital quality accreditation with clear function and authority, which should be spelled out. Membership of the steering committee or team. Usually you must have a senior management representative, if not the hospital director or the CEO. And then you must have a chair with competency in hospital accreditation and leadership. And then the cross-sectional or multi-sectoral membership with representatives from key functional areas of the hospitals, which I already mentioned earlier. The steering committee formulates a master plan for hospital quality accreditation, master plan for one or master plan for other, because the master plan can include 2 or 3 external quality accreditation. The steering team decides on the set of standards to be assessed or evaluated by an accrediting body. Then after that, the steering team seeks commitment for support and collaboration from top, senior, middle, and lower management on the hospital quality accreditation project. Before I go to the next prescribed learning objective or outcome, let me discuss this topic first. The road to quality accreditation, how necessary and who cares? Is it really needed? This is a common question asked particularly by hospital administrators and managers. Is hospital quality accreditation really needed? The general answer is it depends on your need and situation. This is how I'm going to answer this question. If there is a need, if there is a need to participate in the National Health Insurance Program like the PhilHealth, then get the benefits of it from it, go for the PhilHealth accreditation. If there's a need to participate in medical tourism program and get the benefits, go for international accreditation such as ISO, JCI, and ACI. If there is a need to satisfy the requirements of corporate accounts, go for an accreditation. If there's a need to satisfy the expectation of the community, go for an accreditation. And lastly, if there's a need to be known as the best hospital with performance excellence, then you can go for the Philippine Quality Awards. Situation. If there is a situation to be with the trend of having an international accreditation, meaning not to be left out, there's a strong community expectation, then go for the accreditation. If there's a situation that you want to fast track the improvement of the quality and safety of the operations and services of your hospital with an accreditation project, then go for an accreditation. which will include assessment, training, improvement, and evaluation. So these are the benefits that you can get from the accreditation project. Now, the third scenario is that there is no need. Suppose there's no need and no situation, then you can just be compliant with the standards and criteria without going for a formal accreditation. Just accomplish the compliance with self-directed learning and improvement. So it just need leadership, managership, and some direction from the top management, and also discipline and perseverance. So as I said, you can go for self-directed learning because one can study all the stipulated standards in the different sets of published quality standards, which are readily available in the internet, and just come out with an integrated checklist and then comply through self-directed learning and training and continuous improvement. We have covered all the items in numbers in the second prescribed learning outcomes. Now let's go to the third prescribed learning outcomes, which is to develop the ability to pinpoint and isolate management and administrative problems in the hospital quality control program and offer relevant solutions. Here, I will share with you the common problems which I have encountered in the past and the suggested solutions. I shall categorize the common problems into three phases: pre-hospital quality accreditation phase, hospital quality accreditation phase, and the post-hospital quality accreditation phase. There are problems that cut across the three phases, meaning problems that are present in the three phases, or problems in the earlier phase that may persist or spill over to the next phase, or phases, or problems predominantly present in a particular phase. Here is a list of what I think are the common problems in hospital quality control program. Number one, varying perceptions and definitions of quality of clients and hospital and department staff. Number two, established mindsets and habits of staff from top management to managers to rank and file, where a call for a change for improvement is extremely difficult. Number three, the cost of accreditation, as accreditation entails cost. And number four, inherent difficulty in developing and institutionalizing a comprehensive, aligned, and integrated quality management system in a hospital. I'll expound each one by one. The foremost challenge or problem is the varying perception or definitions of quality of clients and hospital and department staff, practically everybody. So it includes patient clients have their own perception and definitions of quality. So are the physician clients, they have their own, and the staff and also the hospital managers probably, most likely, have their own interpretations and perceptions of quality. To show you that this is the case, in 2010, I made a survey on the perception of hospital administrators. This is all over the country, physicians, non-physician health professionals, and patients as well, on the parameters of excellence or quality in a hospital. A total of 141 respondents was obtained by May 2010. There were 34 hospital administrators, 34 doctors and physicians, 39 hospital staff, and 34 patients. So I got varied responses from one group of respondents to another. So collated responses revealed 58 specific parameters for excellence. That is very many, which can be grouped into 11 categories here listed here. So the greatest majority of respondents placed infrastructure and facilities as the number one excellent parameters. The next is medical equipment and drugs. And then 3 is governance with excellent services as number 4. On the specific parameters on the infrastructure, and facilities, there were varied perceptions of quality among the different groups of respondents. Just to cite you two examples, a great majority of the non-medical, which is the hospital staff, put significant weight on modern infrastructure and facilities compared to the medical staff. The hospital administrators, the physicians, and the non-medical staff put significant weight on complete and well-maintained infrastructure and facilities compared to the patients. On the specific parameters on services, again, there were varied perceptions and quality among the different groups of respondents. Again, just to cite you two examples, the physicians and the non-medical staff here put significant weight on complete services and also efficient services compared to the patients. The physicians put significant weight on the presence of 52%, on the presence of multi-specialty medical services compared to the non-medical staff and patients. So how do you resolve the varying perceptions and definitions of quality of the clients and of the hospital and department staff? A suggested strategic solution is the following. Hospitals should look at the perception and definitions of quality of the clients. This is, when you say clients, we refer to the patient as well as the physicians, and then try to meet the requirements as indicated and as appropriate. In the ISO managed quality management system, the starting point, note that the starting point are always the determination of the customer requirements and the needs and expectation of the relevant interested parties. So that's why you have to start here. Okay. So look at the requirements of your clients. And then in the PQA, same is true. They put a lot of importance on the customers or the clients. So that's why you have the customer focus here. So this requires that the organization or the hospital determine the requirements, expectations, and preferences of the clients. The standards have these three items in this particular PQA standards. You have to listen to the voice of the customers. How do you listen to that? Okay, they will ask you why. How do you listen to the voice of the customers? Then how do you listen? Okay. Then listening to the current, then listening to the potential customers. So this just shows the importance of putting a list of determining the requirements of the clients. But in reality or real practice, it is extremely difficult to get uniformity on the needs of the patient clients as well as physician clients, as they always have varying perceptions, definitions, and mindsets. Thus, to support this search for customers or clients' needs, a suggested strategic solution is to look at the current standards of quality in hospital management, abroad, as well as at home, and adjust accordingly, and use this to manage the expectation of the patient clients and physician clients through education and changing the mindset. So through education and changing the mindset. So this is the most, ultimately, this might be the most important strategy. The second most common problem that we encounter is established mindsets and habits of staff from top management to managers. The rank and file will the call for a change for improvement is difficult. The common contributing mindsets are, if it ain't broke, it don't fix it anymore. Don't disturb our current comfort zone. We're happy with it. Okay? This situation is particularly true where the hospital is currently financially stable, regardless of the status of its quality management system, and the owners and leaders are not wary of the threats to financial sustainability from other competing hospitals. These hospitals tend to preserve the status quo without continually improving their quality management system, and more so without going for hospital quality accreditation, particularly when the cost of accreditation is considered or factored in because of the high cost. For this problem or challenge on established mindsets and habits of complacency, and without putting utmost importance to hospital quality program, I guess improvement or change in the governance and leadership direction is very crucial. The leaders and owners should first realize the importance of an excellent hospital control program, quality control program in promoting financial sustainability. After realizing this and subscribing to it, they should take the lead and convince and educate all the staff to pursue an excellent quality management system with or without hospital accreditation. As I said, you don't have to go, it's not absolutely necessary that you have to go for hospital accreditation. The cause of the third problem is the cost of the hospital quality accreditation. This is a common and realistic challenge. As I said, accreditation entails cost. Okay. Look at the cost again. So just remember this table. Okay. It just shows the cost of the initial accreditation. And then what is not inputted here is there's a maintenance cost. When you maintain the accreditation, usually every 3 years, there's still another cost there. Okay. My suggested strategic solution is to look objectively for the indications for a hospital quality accreditation. One may not need a hospital quality accreditation if one can do self-directed learning and training and improvement. Of course, for the Philippine hospitals, you have to, at the minimum, you have to go for the PhilHealth accreditation. Remember this slide that I presented earlier? There's no need and no situation indications. Again, remember this slide, if there's a need indication. Remember this slide, if there's a situation indications. So the last problem is the most challenging. After the decision to establish and develop and institutionalize a hospital quality management system, okay, so this is the most challenging part of the entire hospital. It is not easy. It is inherently difficult. It is extremely difficult, especially if one is to develop and institutionalize a total quality management system involving the whole hospital, where there is a lot of people there, and involving the whole staff with varying healthcare professionals and non-healthcare support staff, and where the alignment and integration are the key risk areas and performance indicators. The challenges start with the formulation of the blueprint of the quality management system in each department and its services, including the governance body and board of directors. Then the challenge is to make this quality management system of all the departments and services aligned and integrated with each other. Then implementation itself, where there must be demonstration of aligned and integrated behaviors and activities. Then monitoring for conformities and non-conformities, another challenge. And lastly, formal evaluation of the quality management system at planned intervals, say yearly, with formulation and implementation of continual improvement program. Challenges in the implementation, all the staff from top management to middle managers and rank and file should be engaged, meaning committed and also trained in the formulation of blueprints, implementations, and evaluation of the continual improvement of the quality management system. All the staff from the top management to the middle managers and rank and files should be constantly aligned, coordinating, collaborating, integrating with each other in accomplishing a total quality management system. Usual findings in hospitals based on experience, I guess you will not disagree with me, is the Ninas, Kugon, or Pugon. I won't expound on that anymore. And also the incomplete and incomprehensive, not aligned and integrated quality management system, hiding non-conformities to stipulated policies and procedures by staff, hiding. And in those for surveillance visit, after the initial accreditation, staff would work double time to ensure passing by covering up on non-conformities and catching up on fulfilling requirements of the standards rather than doing it on a daily basis. So this is really a tall order. So it really needs a strong leadership and extensive training. So before we end this section, here again is the list of common problems that I have observed in the hospital quality accreditation, varying perceptions, definitions of the quality of the staff, established mindsets. It's difficult to institute a change, cost of the accreditation, and the inherent difficulty of developing and institutionalizing a comprehensive, aligned, integrated quality management system in a hospital. We now go to the last learning objective, which is draft a hospital quality management system framework patterned after ISO 9001-2015 framework that can be used as a guide for developing a hospital-wide operations manual. This is the ISO 9001-2015 Quality Management System Framework, which can be used as a guide or the starting point to draft the quality management system of the hospital. So I just convert it into another form. Okay, so this is the same diagram that I showed you earlier, this one. Okay. So one just have to put in description, elements, and preferably a management system in each of the boxes, all of these boxes. Okay. One can read the stipulated standards of the PhilHealth Bench book. This is for in the Philippines. In Malaysia, probably you can have the national quality program there, okay, by the Ministry of Health. And then the JCI or ACI, just choose one. If you want to combine the two, get the best, let's say the best elements that you can find in each of the two accreditation standards. And then in the Philippines, you can also use the PQA, okay, standards. Then, so read the stipulated standards in all these three or four, and then incorporate or integrate them into the ISO standards or boxes, in all the boxes here, as applicable. So this is an example of an adapted framework of ISO 9001-2015. Okay. As I said, it's not only called a quality manual, it can now be converted into a hospital governance and operations manual, or another term for that, the hospital quality and safety management system. As mentioned earlier, one has just to put in all the descriptions, elements, and preferably a management system in each of the boxes, guided by and compliant with the established standards of ISO, PhilHealth, ACI, JCI, PQA. And once done, the whole manual shall be called the Hospital Manual for Quality and Safety Management System. At the same time, it can also serve as the Hospital Manual of Governance and Operations. Preferably, there must be write-up on each box or standards in the format of a management system. Example, for the client requirements, like here, client requirement. You can put client requirement management system, legal requirements, client engagement management system, performance excellence management system, leadership management system, and so forth and so forth. So here is a sample template in writing the management system of its standards with the following content. Okay. Title, concept, meaning, definition of scope, rationale, purpose, policies, procedures, work instructions, review of policies, procedures, and work instructions, and then policies on non-adherence to established policies, procedures, and work instructions, and then notations on the document number, versions, date, release, prepared, and approved by. So to end my presentation, I'll flash again the prescribed learning outcomes and objectives, which I will not read anymore. We have covered everything. So I really hope you have acquired the prescribed learning outcomes through my presentation. I hope you will have questions that I may be able. I hope I can answer all your questions. Thank you for your kind attention. Okay. Any questions?
Professor, good afternoon. This is Ninay.
Geraldine.
Yeah. Opo.
What's your nickname? What's your nickname? Ninay?
Ninay.
Ninay,
It's
yeah.
like, opo.
Yeah.
Sir, my first question is, will you kindly comment on the DOH Hospital Star Awards? Is it a, will you consider it as a, something like an accreditation and something that can promote the hospital's business development program? Because they give these awards. Are you aware of it?
I'm sorry, I'm not so Star Awards. Bago lang ba ito? Is that new?
Oh, actually, it started, I think, 5 years ago. And I saw they have another, they have posted for the hospital DOH Hospital Awards for 2022.
Mm-hmm.
They have one. Actually, I'm affiliated in one private hospital, and we were awarded
Okay.
for level 2 hospital.
Okay. Congratulations.
Yeah, I think if I remember right, that was 3, 4, or 5 years ago before the pandemic, Professor.
And then now,
So,
are they still continuing?
I'm not aware, Professor.
Okay.
Uh-huh.
Well, I guess
If you look at the DOH, my signal is quite erratic. If you look at the DOH, what's this DOH website? They have it,
okay.
Star Awards, and they
Yeah.
give a plaque.
Yeah.
And the plaque is actually visibly displayed in that hospital.
Okay. So let me answer to you this way. There'll be a lot of motivating awards by external bodies, no? Okay, like DOH, and also hospital management awards. You have heard about it, no? Hospital management awards. Yung mga recognizing best hospital in Asia, no? Okay. So there will be a lot of awards trying to stimulate, actually most of the hospital management award is more of a business, may business, there's a business implication there. But for DOH, it's really stimulating or motivating hospitals to become better. No? Okay. So I don't see, I guess if there's such an awards, go for it. No, go for it. So it might help in your business development program. It might improve the reputation of your hospital. As to what extent, I really cannot tell. No? Okay. So
All right.
in the past, they also started with the PhilHealth Bench Book. There are 3 categories of PhilHealth Bench Book. One is the basic. The other one is the when you pass the basic one, you have the so-called hospital quality.
Center for
Center for
Excellence, Quality, and Safety.
Yeah. And then after that, it disappeared. No, it was never carried out. No?
Yes, that was actually my next question. Yeah.
Yeah, I remember that also. No, so up to now, I don't know. It's still they removed the 3 categories and then they just went for the two categories. No, but up to now, we have not seen the second category. So the second category, it's a higher category in which once you get recognized by it, they said that you have more benefits. Now that the more benefits that you can get from PhilHealth. but it's not yet being implemented up to now, so many years already. So in answer to your question again, there are a lot of, because as I said, you want to improve the reputation of your hospital to attract more patients, more clients. No? So whichever you think will be very strong, very powerful, in which you can get a lot of benefits, go for it. No? Okay. So I really don't know what will be the impact. Just like at the moment, I can talk about the Asian Management. Have you heard about the Asian Hospital Management Awards?
Yes, sir. The HMA.
Yeah,
Opo.
HMA.
Opo.
Okay, so there are a lot of private hospitals going for those awards. So I really don't know what will be the impact. So then when they went for it, now they usually want to have create some reputation, they market it. They market it. Now they try to say, oh, we are the owner. We are a winner of the hospital management awards this year. That okay. So I really don't know what will be the impact. No? Okay.
Okay, Professor. I have a follow-up question, Professor. What is your take on the how can I best express it? I mentioned this to our admin because we are planning to go for ACI, and I was telling them we still haven't gotten any local awards yet. So I actually suggested applying first for this Star Awards. And then you mentioned about the PQA. So I think the PQA, when you mentioned it a while ago earlier, I think it's a very nice accreditation award to have at the moment, rather than seek international recognition,
Is there an
which is more
indication?
expensive. So
Yeah.
I was, am I how I think my mentality is saying that why go international when you haven't gotten any local accreditation awards yet, or accreditation for the
Okay.
and yes.
You're
Do
partly
you
correct. You're partly correct.
ca-
You're not yet. You have not achieved any accreditation. Why go for a higher? You're partly correct, but you look at the needs already. If there's a really need for a international accreditation, urgent need, go for it. Now, as I said, if there's a need for, you can get benefit from the international patients, corporate accounts. No, that your hospital will have to go into it because of that requirement. Then go for it. But if there is none, you go slow. You can go to the lower level. Or you can go for ISO. No, ISO can also carry some international reputation. No, okay. So if you don't like to go for the international accreditation yet, you can go for the local. No, so of course not the
local,
not the
then ISO, which is not that expensive.
Yeah.
I mean, and then go for the international.
Yeah, you can. Usually, I would suggest that you go for the ISO, no, and then PQA. It's harder to get the PQA awards at the ISO, but sometimes you can go.
Oh,
You can
okay.
go, because PQA is very strict with all those the results. No, okay, with the results of the benefits that you can get from your quality management system. No, and you have to be better than other hospitals. No, so they look at that.
Oh, okay.
But
Okay.
of course, they have different levels. Different levels. Just to tell you, as I said, you can jump from you can jump to PQA right away. Not really going through ISO, but if you have an ISO, it will help you with the PQA. Earlier, I told you that there's some similarities in the processes of all these accreditation frameworks. No? Okay. So let me let me share with you a slides. Wait. Okay. Can you see this one?
Yes, Professor.
So this is Ciudad Medical Zamboanga. This is one of the private hospitals in Zamboanga. It's about 200 bed capacity. So in 2009, so I helped them. Now we went for strategic planning using the PQA criteria. From the very start, we use the when we do our strategic planning, we already use the we were guided by the PQA standards criteria. Okay, because we look forward to a PQA award. No? Okay, so, and then in 2010, I think they got the PhilHealth Benchbook Center for, which one came first? Safety muna, that's the lowest, safety. And then 2011, they got the recognition from the PhilHealth Benchbook Center for Quality. Then after 2012, we had another session of quality management strategic planning. Then after that, we were able to, I was able to help them get the Philippine Quality Awards. Okay, so this actually, history-wise, in 2013 or 2014, now Ciudad Medical Zamboanga is the first hospital that got the Philippine Quality Award, but it's still at the lowest level, no? Level 1. There's several levels, level 1, 2, 3, 4. No? The highest award is the level 4 or 5. No? Okay. Then that's but even at level 1, you have the president awarding the trophy already to the hospital. So in a way, it's already prestigious. No? Okay. But the best will be to get the highest award. No? Okay. So this is they didn't go for ISO. Okay, so they go direct to the Philippine Quality Awards. Okay. Okay. So it's because of this experience now that the Philippine Quality Awards started coming out the healthcare criteria for hospitals already. No?
Sir, and they give awards by level of hospital, level 1, 2, 3.
No, the Philippine
Or they do
Quality
not
Award,
stratify.
no, it's
They do not stratify.
no. You can apply, but it's the level 1, 2, 3, 4. It's more of the it's just
Yes.
the quality, the highest quality. The highest quality is
Yes.
the
Level 5.
level 5 or level 4. I forgot the number now. Okay. So that's the highest quality award. But even with a level 1 hospital or level 2 hospital by Philippine DOH definition, you can get the highest standards. No? Okay. Okay.
Professor, what I mean is do they stratify their standards criteria by level of your hospital if
No.
if you're a level 1?
No.
No.
Okay.
Okay. It's results driven.
So yeah.
So much more. Okay.
Level 1 means that your quality management system is not very robust yet, but at least it has assembled. It will a little mature already. Now it will pass. Now, so that's why next time you go try to strive to level 2, level 3, until you reach the level 5. Now, okay. Just like you talk about ACI, right?
Yes, we were. We are in the planning stages of applying, but nothing concrete yet, Professor.
Okay. Yeah, that's why. Okay, now I'm just trying to pick up the ACI. ACI has also three different levels. No, you have the gold. I think the second level is diamond or platinum, and then diamond. No, okay. So the lowest level is gold. So in the PQA, it's equivalent to 1 or 2. And then higher level of accreditation is that just means your quality management system is more robust now, better than before. No, okay. So that's why you can have gold, and then after that you have the I don't know what it's. I think diamond is the highest, no, than the platinum, no, okay. So in ACI, I think there's only one, no, whether you're accredited or not. AC and JCI, no, okay.
Okay. Thank you, Professor. Thank you.
You're welcome. You're welcome. Any other questions? No questions? Okay, Dr.
Nagtataas si
Gonzaga.
Dr. Gonzaga.
Hi, sir. Good afternoon.
Good
Uh,
afternoon.
um, uh, Actually, this is from a personal experience because my mom is in and out of the hospital, and we've experienced like the different services in big hospitals in Metro Manila. And I noticed that though they are ISO certified, but there is difference in, this is a perspective of a medical doctor, but there seems to be different approaches when they know that the relative is a doctor, or if or I mean, the level of service that they give to you will be different if they are aware that the patient is a relative of a doctor, versus not telling them that that you're a doctor and the patient is your mother. There's always, sometimes I would hope that um, why do I have to tell them that I'm a doctor for them to improve their services despite of the ISO certification? What are your thoughts about this kind of practice in our hospitals, that the relatives of doctors are treated a little different from those who are non-relatives of doctors?
Parang VIP, di ba?
Yes, yes.
That's like when we treat VIP, you give special treatment. Yeah. So when they know that you're a doctor, or you have a patient as a relative of a doctor, no? So they tend to be more careful, be more what do you call that? Provide, I won't say more quality, more quality. Dapat it should be the same. It should be the same, strictly speaking. No? Okay. It should be
Yeah, yes, so I agree.
just like when I okay, I think it should be the same. Let's say if I have my relatives whom I am going to operate, no, okay, I can operate on him or her with the same quality that I will operate on a patient who is not my relatives. No, that's how I look at it. No, of course, a lot of doctors do not want to operate on their relatives because they thought that they might be affected by their decision making. No, okay. Okay, but for me, once you have a quality management system, it should be applicable to everybody. Pare-pareho lang yan. No? Okay. Okay. So, and then remember that is, once you have an ISO certification, once you have a JCI certification, once you have a ACI certification, or even with field health, now doesn't mean that you are entirely, you are perfect already. No, it doesn't mean that you're perfect. No, so there's still a lot of flaws there. That's why in the framework, it always included there must be continuous improvement, continual improvement. No, okay. So there's always a box there. PQA has a box there. Continual improvement management system. It must be in place. And also in the ISO continual management system in place. No? Okay. So it's not always perfect. That's why there are a lot of flaws. So what's more important is that you detect it, then you try to change, you improve on it. No? You change it. No? Okay.
Thank you, sir.
Okay. Any more questions? No more questions?
Professor, pasensya na.
Okay lang, go ahead.
If I may add with from the observations that you mentioned, with regards to, some of the hesitancy or failures in the accreditation.
Okay.
We find it, the fast turnover of staff to be a significant hindrance as to the attainment of, or somehow, to the implementation of our QMS. Yeah, because we had this in the past we had this very effective staff that was trying to help us with the ISO, and then he left the organization to Canada. He went to Canada, and after that, we're having so much difficulty trying to find a quality person.
Yeah.
And then, yes. So, and then our, the rank and file, the middle managers were also aside from the, the change, in the Ninga Skugon, I think it's not only that. We have quite a few competent staff, I would say. But then, the fast turnover is really posing a big problem for us towards achieving accreditation. Just to move forward, towards achieving our accreditation. It's really a big challenge for us. May I ask for some suggestions or comments on how you face this kind of obstacle?
It's no different from the stories that fast turnover of doctors, fast turnover of others type of staff. Okay. And then also when you have a competent mechanic for a car, you use a mechanic or use a doctors. Pag namatay na, the patient died or the doctor died or the mechanic died, you start looking for another one. That's a challenge. Right? So I guess, as I said, in the four problems that I mentioned, it's really inherently difficult. No? It's not really easy. No? So you have to take all these things into consideration, the fast turnover, and then come out with a strategy, which I cannot really say with definite certainty now, because in the past, it's the same thing. A fast turnover of nurses in the Philippines, you get a lot of problems. No? In hospitals, fast turnover of residents, especially when you say new residents coming in, you have a lot of mortalities, morbidities in the first few weeks of the year, something like that. Okay, so you must be able to anticipate all these problems and then come out with the solutions. No? Okay. Number one, probably that put down a manual in place. That's my suggestion. A manual that is that will set the policies and procedures and everyone should follow. Okay, everyone should know about the manual and policies and the content of the policies and procedures. Okay, and then if there is somebody going out already, you try to look for a what do you call that? A substitute or a backup, somebody who can train just in case somebody will go away. Okay, so always have that in mind. Okay, somebody will in due time somebody will go out, so you must have a backup. Okay, so one who will take over right away with the same competencies. No. Okay, so in this particular situation, we're not talking about salary factor, right? Okay, it's more of really person going out with a good reason. So you must come out with a system in which you can have a ready backup for all these losses. No? Okay, possible losses. So again, put the system in place, then have everybody practice it as much as possible. Everybody then have a second in command that who can readily get up to the higher position once the position is vacated. No? Okay. So I guess there are lots of other solutions that you can think of. But at the moment, that's the only most practical recommendations that I can give. No?
Okay, Professor, appreciate it. Really very challenging times
Very
ahead po
challenging.
talaga.
Yeah, very challenging.
Opo, opo talaga, opo.
Okay. So
Thank you very much.
anticipation. Kaya importante yung leadership and managership. Always
Opo.
be on the lookout for all these problems. No? Okay. Any more?
Okay,
questions?
thank you again.
If there are no questions, before I forget, I'll just put in the chat box I'll put in the chat box the olete that I'm the olete on hospital quality accreditation. It's there now. Okay. So please try to answer them. Answer the olete now. Okay. And then I'm waiting for other people to ask questions. If there's no more questions, I'd like to thank Geraldine for submitting a write-up on the management system. I want to flash it with your permission, Geraldine. I got it from my email. Now, can I flash it? Geraldine?
Or yes, Professor po. Yes.
So this is related to the first topic that we have last time, first lecture.
Yes.
And also,
Opo, opo.
as I said, this is also related to this topic today, right? So remember, I told you that in all those
Yes, I
boxes,
noticed po.
in all those boxes in the Philippine Quality Award or the ISO, you must have some policies and procedures in place. A manual, not a manual, not okay. So I'll try to retrieve it. Okay, can you see all this? The paper submitted by Geraldine. Okay. Or would you like to be the one to present it?
Po? Professor.
Maganda eh. I appreciate
Okay.
it. I appreciate
Opo po,
it.
sige po.
Sige,
Oh,
ikaw na.
talaga? Oh, sige po.
Okay.
Well, anyway, the reason why I got interested with this program is because, as I mentioned, being in the ancillary division, we have so many equipment, and I always, I always get into this. I have concerns with regards to preventive maintenance and corrective maintenance. So that's why I chose this framework. So basically, this is
the name of your department,
in our hospital. This
the name of your
is
department
Engineering and Maintenance Department.
that's your department. So this is
Opo.
your framework, right? And then within the
Actually, yes, actually, opo, in the report, this is handled by our FDMD, Facilities Development and Maintenance Division, Professor. So
okay.
this is not really under me. Opo.
Okay.
So
anyway, so
but
you
then
chose
yes,
this
so
particular topic, okay? Just one, di ba? Because it's really
Opo,
difficult to
opo.
complete everything, right? So it will take time. So, but for
Yeah,
the
that's
you take one just to illustrate the importance of doing this, doing this exercise, okay. So you
yes.
chose the equipment material management
Yes.
program, and then that's good. Now,
Opo.
so once you write it up, it's part of your quality management system already, right? So in the
Opo.
the manual is that you have all these things. You have the control documents, approved, prepared by whom, reviewed by, okay. So all of this should be documented now, and then
Opo.
so this is the more or less this is the so-called mother manual now for this particular box, medical equipment management system manual. Then you have the introduction, okay, and then the table of content. So you can see that for the class, you can see that there are a lot of items subset in this particular manual. Now you have about 11, 9, now 9. Now. So policies and procedures on needs assessment of medical equipment, budgeting, financing, technology assessment, etc. Okay, so as I said, it's not easy to come out with a manual, no? But you have to start somewhere, no? Okay, and then try to be comprehensive, and then of course system thinking, include all the other departments involved as well as all the items in your department, no? Okay. Now, in this particular exercise, Geraldine focused on this particular policy, policies and procedures on maintenance and repair. Okay, so I don't expect her to write everything. But I don't know whether you're done with all these things by your other colleagues. No? Okay, but for the moment, Geraldine submitted this one to me. Now, policies and procedures of maintenance and repair of medical equipment. So this is the focus of her work now. So again, there's the concept, no? Concept of this particular paper. And then definitions. No? So we talk about medical equipment's maintenance and repair. We talk about calibration. So she defined calibration. And then she also defined corrective maintenance, equipment maintenance, failure, high risk, inspection, medical equipment, no? So used for diagnosis, treatment, monitoring, and direct patient care. And then performance inspection, preventive maintenance, safety inspection. So very comprehensive. Then after that, the next topic is scope of this document. Then the rationale. The rationale is to provide clear policies and procedures on maintenance and repair to keep the medical equipment reliable, safe, available for use when it is needed for diagnostic procedures, therapy, treatment, monitoring of patients. No? And then proper maintenance of equipment prolongs its useful life and minimizes the cost of equipment. So these two statements are very important, no? Okay, to know. Okay. And then policies. So she came out with a one particular area in the document policies. Policies on preventive maintenance, and then policies on corrective maintenance, and then procedures. Okay. After the policies, usually you have procedures coming out. The procedures, as differentiate from the work instructions, is more general. There's a work instructions here. This one is more detailed, now in scope. Okay. So she has procedures for the corrective and preventive maintenance, and also work instructions for preventive and corrective maintenance. And then there's a statement here, review of policies and procedures. So this will be reviewed annually. Okay. So once you put there annually, it has to be implemented and revised as needed. Huh? So once the accrediting bodies, third party come in, they will always check, oh, did you review your policies and procedures? Show us the evidence that you have reviewed it. Okay. So if it's not reviewed, no, so you fail. Hindi ka papasa, you fail. No? So a lot of, as I said, one of the challenges here is that in the quality accreditation, some will just wait for the visit of the accrediting body, and then they start to patch up. No? Oh, we have not reviewed this. Let's try to review it and then put it on paper that we have reviewed it. No? Okay. Then lastly, there's a statement here, non-adherence to the established. So this will be handled by the hospital employees handbook. No? Then in this particular document, it's nice to have a diagram as to the process. No? Preventive maintenance process flow, okay? And then corrective maintenance process flow. Yeah. And then references. No? Okay. So I'd like to congratulate Geraldine for submitting. I've not received the other reports. Are you going?
Sir, sorry.
Thank you, sir.
Hindi ko na forward pala sa inyo. Sorry, sir. Ngayon lang,
Okay.
pinorward ko lang ngayon. Oh.
Okay.
Sorry.
So I thought you won't submit anymore. Okay, but it's nice to have this one. So it just illustrates the system thinking and also the topic that I discussed today, the hospital quality accreditation. No? Okay. Okay. Congratulations. Thank you, Geraldine.
Right. Thank you po, sir. Thank you.
Mhm.
Buti na akala ko po. Thank you. So I did follow naman po yung ano niya, no, yung gusto niya, no. Tama naman po in a way, tama naman po pala yung ginawa ko.
It doesn't have to be. What's more important? It's not as important that gusto ko what I want, but what you think is. What do you think? What do you think? Is it nice? Is it a nice template to follow? Simple to follow.
Yun nga po.
Wala. Wala. Choppy. Choppy. Choppy.
Actually, the material in existence in our hospital are just humans arose only below.
Hello. Go ahead.
Yan po, okay na.
Okay. Yeah. Okay.
Yan. Actually po, when I asked po our FDMD, the facilities and maintenance, specifically the biomed section, they only gave me 2 or 3 documents for my review.
Okay.
And from my analysis, it looks like, they only had these documents. Probably they had some problems or something, and they came out with this kind of document. So wala pong ganyan talagang parang manual. So parang sabi, actually the guy appreciated me and he wanted me to share whatever output I come up with. And for the references, I found this very nice book on the life cycle of medical equipment. So I patterned my table of contents from there, from the time you have this need assessment for a particular equipment up to the time of up to the disposal. So that's how I arrange my table of contents.
Good.
And then I think moving forward, if we will have to have this QMS manual, I think I will recommend to our admin, di po ba, i-reference na lang kasi some of those parts are like finance na po yung sa acquisition, di po ba? Parang sa ganon. So parang i-reference niyo po yung policy nila po, di po ba?
Yeah. Okay. So the general principle that I'm sharing with you is that you try to get hold of all established publications, just read them and then see what are applicable. It's all there already now. Okay. WHO and then other experience of other hospitals. Just like when I say that if you don't like to go for formal accreditation, you just get hold of the standards of PQA, JCI, and then fill out bench book and then study them and then integrate them and then try to implement. Try to study and implement. No? Okay. So you will be able to get to a place where you want to be. Okay. And then try to you can simplify things. Actually, what I presented to you is just a simplification of the template. No? Okay. In the end, what's very important is everybody, there's a manual, there's somebody is teaching that, and then it's being implemented to the letter, and then there must be continual improvement. Okay, so every year, at least every year, there must be revision, additions, or even subtraction of what you wrote there. No? Okay. So you may not be able to complete all the 9 chapters on the policies and procedures, but you can start doing it now. Okay. So that at the end of the year, once you go for accreditations, now you're done. Okay. Okay. So I'll take a look at the other. Charlie, where did you send it to me? Where?
Sa email niyo, sir, sa Yahoo po.
So I'll take a look.
Sorry, sir, ah.
Okay lang. Okay. So any more questions? We still have 20 minutes. No, okay. No more. I just want to say that again, to repeat, once you have a quality accreditation, it doesn't mean that's perfect. Now, there are a lot of flaws, there are a lot of deficiencies yet. It just have to be, there must be continual improvement. No? But it all depends on the commitment of the leaders. No? Okay. Okay. So keep on improving. Any more?
Professor Ninay uli po, just out of curiosity po, meron na po bang hospital in the Philippines who got a level 4 or 5 sa PQA?
Wala pa.
Oh, okay.
Go for it.
Oh.
Go for it.
Sige. Oh, sige. Sana po. Okay. Sige po.
So, sinong president gusto mong, which president do you want to award?
Sir, meron po bang bukod sa level 1 may naka-level 2 na lang po ba? 2 or 3 ganyan? Wala pa?
I'm sorry, I'm not aware of that.
Okay po.
After that, I just decided to retire already.
Okay. Opo. And Ciudad Medical Zamboanga is a level 3 hospital, Professor?
No, level 2. There's no training program.
Level 2.
Now it's
there's no training.
I think it's level 3 now because they established a residency program in IM, internal medicine. No.
Okay po. Opo. Sige. Thank you for that info po. Thank you.
Okay. Okay. No more questions? Can we Charlie, wala na?
Mukhang wala na po nagtataas, sir, eh. Photo op po ulit ba tayo?
Sige, photo op tayo. Photo op muna para makita ko yung mukha nila.
Tapos, sir, magkikita ulit tayo. May 15 na po, no?
May 15. Okay.
Opo.
How long,
Kasi yung...
how long is this semester? But how come it's too long?
Hanggang ano po to, sir, eh. Hanggang almost, last week of May.
Last week of May. Okay.
Ang summer vacation ngayon is June, July, August na po.
Okay. Sige. So May 15.
Yes, sir.
Okay. Okay. So let's have our picture together.
Kindly open your cameras. Dr. Gonzaga and Michelle and Shaira and Caris.
Okay. Michelle.
Okay, sir. On your command po.
1, 2, 1, 2. Okay.
Okay na kayo, sir?
Yeah.
Sige po.
Okay. So you've seen the Olete there, huh? So can I have it by tomorrow?
Please answer the ulit. It's also attached in Canvas, no? So you can look at the link sa Canvas and answer it. So deadline tomorrow.
Okay.
Okay
Bye-bye.
po. Thank you. Bye-bye, Professor.
Bye-bye.
Hi, sir.
Thank you po. Thank you po. Thank you,
Thank you, sir.
Professor.
Thank you,
Opo.
sir.
Welcome.
Okay, class, bago tayo maghiwa-hiwalay, don't forget your management problem topics. Only 4 people have submitted till today. So I would like to follow up your management problem topic that you will present on the end of the semester. No? Sige. Kindly email me na lang. And thank you.
Okay.
Sir.
Thank you po.
Okay, bye po. So class dismissed na po, sir.